Let's talk about the difference between primary and secondary hypogonadism, or at the very least, primary and secondary low T or suboptimal T. But before we get into this is not medical advice. This should not be used to treat or diagnose medical conditions. This is for educational and entertainment purposes only. Before we get into it, it's important for you to understand how the HPTA works, the hypothalamic pituitary testicular axis. So this is how it should work. So your hypothalamus releases GnRH. That stands for gonadotropin releasing hormone. GnRH then hits the pituitary and tells your pituitary to make LH and FSH. LH hits the Leydig cells in the testicles. FSH hits the Sertoli cells in the testicles. Sertoli cells result in spermatogenesis. Leydig cells then cause testosterone production. Testosterone goes through a process called aromatization and makes estradiol. So your body doesn't make estradiol in the strictest sense. It aromatizes testosterone into estradiol. Androgens get aromatized into estrogens. What happens after this is testosterone and estradiol mostly, but testosterone as well, goes back to the hypothalamus. So if estradiol is low, or testosterone is very low, but again, mostly estradiol, what's gonna happen is your hypothalamus is gonna recognize that. It's gonna increase GnRH, hit the pituitary, and the cycle continues. So there's negative feedback, namely, as your hormones go up, there's less GnRH. As your hormones go down, there's more GnRH, and then that cascade continues. If you look at this chart, it kind of makes sense why certain drugs like exogenous anabolic steroids, even like Anavar, can lower your body's natural testosterone production. Because you're basically having a synthetic androgen step in for testosterone that then tells the hypothalamus, hey, we have androgens present, let's lower GnRH. So I don't know why some people think that you can take like certain steroids and it not impact your HPTA. I can't say it happens for everybody, but most guys are gonna deal with some suppression of testosterone when you're kind of messing with this right here. So let's talk about secondary hypogonadism, because once you understand that, primary is gonna make a lot more sense. So we look at this chart right here, how it should work. What happens with secondary hypogonadism is that something's going on with the hypothalamus or the pituitary, or maybe even both. So you are not producing enough LH, and as a result, your Leydig cells are not getting stimulated, your testosterone is not getting stimulated. Something is occurring up here in your brain, the hypothalamus or the pituitary. That can be caused by a lot of different things. So it can be caused by things like, for instance, brain damage. If you're somebody that had a lot of like terrible subconcussive blows, even, you know what, some guys that come in that were old military guys, and it's not, even if they weren't combat veterans and got hit with something, maybe even holding a high power rifle against your head and firing 100,000 rounds. This is speculation, but firing 100,000 rounds, maybe those small subconcussive blows are scrambling something with the hypothalamus and pituitary. We're not getting that LH surge to actually increase your testosterone. So a good example of that is this patient right here. So I'm gonna pull up this blood work, and you can see right here, LH is 3.7 on the lower end of LH, and testosterone is 381, again, on the lower end of testosterone. So when you see this suboptimal LH, suboptimal testosterone, you can say this is secondary hypogonadism, or at least in this guy's case, because in the traditional sense, hypogonadism would be lower than 264. This was secondary suboptimal testosterone. So this guy has some options here. The first option is very easy, TRT. And most guys elect to do that. If they don't have to worry about fertility, they don't mind giving themselves a shot. It's very reliable. It's not a very expensive treatment plan. It's something that we can do to bring up their testosterone. Now, your LH is gonna basically go very, very low, if not completely go away. Again, because your hypothalamus, going back to this chart, your hypothalamus recognizes, hey, we have testosterone present, it's gonna lower GnRH, it's gonna lower LH and FSH. So you're gonna have some issues. Most guys, not everybody, a lot of guys have issues with their sperm production because the pituitary isn't getting the signal, so everything else doesn't really get the signal either. All those downstream hormones basically go down. But you don't care if you're on TRT because you're stepping into that spot right there and just manually cranking up your testosterone. So you don't really have to worry about everything else. Now, some guys will want to have some intratesticular testosterone production, so they'll use HCG for things like fertility. Some guys even say they have some sexual benefits from it, but we're just talking about treatment options for secondary hypogonadism or secondary low T or suboptimal T. Now, another option besides TRT is this right here. And I did a whole video on this. I'll link that at the end. You can take a SERM like Enclomiphene. What a SERM is gonna do, Enclomiphene is what we use, it's gonna block estrogen receptors in the hypothalamus. And what the hypothalamus then thinks is, oh wow, we don't have estrogen. We don't have estradiol or estrogens. So we need to increase GnRH, which again hits the pituitary, increases LH and FSH. So it's gonna increase your testosterone. So that's how a SERM basically steps in. It blocks the estrogen receptor, and as a result, your brain thinks it needs more estrogen, so it produces more testosterone. This works in guys with secondary hypogonadism. Another option you have is you could just basically step in for LH. I briefly brought that up. You could take something like HCG. HCG is an LH analog. More or less in the male body, it acts like LH. It's gonna step into that step right there, that LH step. It's gonna hit the Leydig cells and it's gonna tell your testicles to make more testosterone. Now, FSH, when we're talking about fertility, that's a different video. I'll link that one at the end too. But understand you have some treatment options because your testicles work. They do work, but they just aren't getting enough signal. And again, that can be caused by a lot of things. It can be caused from some brain trauma. Some guys speculate it's just because of our environment. I mean, it could be from phytoestrogens in the environment, telling your brain that there's enough estradiol, so it again is reducing GnRH. There's different causes, but understand that it's upstream from the testicles. Conversely, primary hypogonadism. If we look at the chart again, everything is working up until it hits the Leydig cells. So the hypothalamus is sensing, hey, we have low estradiol, we have low testosterone. It increases GnRH, it hits the pituitary, LH, FSH goes up. Particularly, I'll show you an example of LH, but the testicles are getting the signal, they just cannot produce testosterone. Causes of that can be trauma to the testicles, it could be cancer. Something is going on, not in the brain, but again, in the testicles. That is primary hypogonadism. And if we contrast that first guy, remember we saw lower LH, lower testosterone. With this patient right here, this is a more traditional primary hypogonadism. You can see his LH is actually elevated. It's high, it's off the charts. But the problem is his testosterone is 373. So again, that's not hypogonadism in the strictest sense. It would be lower than 264. But this guy's probably symptomatic. This guy probably has some issues. I can't say definitively, but you can see the LH is there. The brain is telling the testicles, make more testosterone. It's just not happening. And unfortunately, in situations like this, at least in our experience, what we find, SERMs don't really work, HCG doesn't really work. Their option is TRT. Now you can do different types of TRT. If you don't want to take a shot, you can do something like Kysotrex, which is an oral TRT therapy. You can do a cream. We like shots, they're more reliable. It's very easy to manually manipulate that. Creams can be good. For some guys, it'll work. Pellets can be good for some guys, tabs, but this is a different example. This right here is primary hypogonadism. So just to kind of recap, secondary hypogonadism is when your body is not producing things upstream from testosterone. Primary hypogonadism is that everything is working up top, the hypothalamus and pituitary, but the testicles just can't do it. That's going to change your treatment options. It could actually change the reason why you have it. Damaged testicles versus damaged hypothalamus and or pituitary. So look, just wanted to put this video together so you guys kind of understood the different treatment options you have based on the type of low T that you're dealing with. If you learned anything, do me a favor, like the video. If you're interested in content like this, don't forget to subscribe. If you yourself are dealing with symptoms of low T, let's say you have low energy, low sex drive, can't recover at the gym, don't have the same drive you used to have, and you're interested in learning what's going on in your serum, see what your blood work looks like, go on my website, Steele Health and Hormone Center, center spelled RE.com. Fill out a contact form. We will be in touch within 24 hours. Again, guys, like the video, subscribe to the channel, and I'll see you in the next video.